Well, good morning, everybody. It is a pleasure to be with all of you this morning. Mental health is obviously a critical issue facing our nation, but especially our community. This is an issue that impacts everybody of all socioeconomic status across the entire county, and we have seen an alarming rate of issues across our entire county. I would like to invite representatives from Everymine and Cornerstone and their boards and the other incredible organizations who are here to receive this proclamation and acknowledge their incredibly important work in our community. We're also joined by Dr. Raymond Crowel, who is the Chief of our Behavioral Health Services within our incredible Department of Health and Human Services. We are seeing an alarming increase in mental health issues across the board, and I think you can draw a straight line to the proclamation we just gave earlier today. We're seeing the ramifications of mental health issues and of a lack of infrastructure and organizations that are doing the best that they can with the precious resources that they have, but that are being overwhelmed every day across the entire board. We are seeing more instances of children trying to access services and engaging in trying to get support throughout our entire community. And we as a county and as a community need to come together to step forward to provide the types of services that organizations like Everymine and Cornerstone offer within Montgomery County and that our remarkable Department of Health and Human Services. We're also joined by our representatives from Montgomery County Public Schools and Dr. Bryce here as well, because there have been an alarming rate of increase among suicides impacting our students across the board. So this is a critically important issue and an opportunity for us to acknowledge the great work that's happening, but the great work that needs to be done to fully address this issue. I'm joined by my colleague, Councilmember Jawando, and all of my colleagues on the council have expressed tremendous support and real leadership in wanting to address this issue moving forward. And so, Councilmember Jawando, if you wanted to say a couple of words, you're more than welcome to.
Thank you, Councilmember Albornoz, and thank you all for joining. I just wanted to say that this issue of mental health, I'm glad we're doing this proclamation. I'm glad we did both of these together, actually. As Councilmember Albornoz said, they're obviously very connected issues. We've heard time and time again from our young people, from those interacting with the criminal justice system, all across the board, age, race, that mental health is a huge issue in our community, and we're not doing enough to address it. So we're going to make strides in this budget with my colleagues, as Councilmember Albornoz mentioned, to improve and expand mental health services and access. But there's more work to do, a lot more work to do, and we're going to need to make more than just incremental progress. And I know Councilmember Albornoz and I, he's on HHS, I'm on education. We're going to be working together along with others on the council to make sure we expand access to these services to all parts of our population. So I just want to thank the community for being here, and thank you, Councilmember Albornoz, for sharing the mic for a second.
So I'd like to invite Dr. Raymond Crowel to say a few words regarding the incredible work that's happening here in the county and also what we're seeing in our community.
Thank you, Councilmember Albornoz, and thank you for the council for taking the time to do this proclamation and call awareness to this issue of mental health, not just across the country, but right here in Montgomery County. We have, there's a saying that health, there is no health without mental health, and that mental health is everybody's business because it's far too important to be left just to the professionals. Sorry to the professionals for that, but I think that, but it sends a point that the people here represent members of the community, members of the profession, of course, but members from the educational system, citizens, concerned citizens and advocates who are interested in promoting the health and well-being of our country, of our county. I think if we don't do something collectively to do this, we have to do something collectively. We have to be strategic about it. We have to align our efforts and coordinate them in a direction that makes sense for the best outcomes for the county. We're about the business not of preventing mental illness, but of promoting wellness first. If we do our work to promote wellness and healthy development, there will be fewer folks on the back end with a mental illness. We want to try to prevent suicides. We're trying to prevent overdose deaths. And I'm happy to say in this moment that as of last week, the number of overdose deaths in Montgomery County had dropped by 30%. So that isn't just a function of what we're doing in behavioral health, but it is a function of everything that is happening in the community. People understanding what they need to do, taking action to help each other and support each other. Without that support, this doesn't change. So we need your continued support and help in that endeavor, in our endeavors. So thank you all for being here. Thank you for this proclamation.
All right, so let's go ahead without further ado, read that proclamation. The County Council of Montgomery County, Maryland, hereby gives the following proclamation. Whereas the month of May is recognized as National Mental Health Awareness Month, which highlights that 1 in 5 adults in the United States experience a mental health condition in a given year, or 46.6 million people per year. And whereas in Montgomery County, our goal is that every resident has the appropriate prevention information and equitable access to effective treatment for behavioral health wellness. And whereas we continue to focus our efforts on reducing the tragic and troubling trend of deaths from drug overdose and suicide. And whereas we utilize interventions that are evidence-based, collaborative with consumers and families, and incorporate strength, resilience, and hope. And whereas we reflect the strategic alignment of compassionate providers, peer recovery specialists, policymakers, and advocates, and whereas we exemplify a knowledgeable, informed, supportive, and welcoming community as we continue to save lives by combating stigma and taking action to ensure the mental health of all. Now, therefore, it be resolved that the County Council of Montgomery County, Maryland, hereby proclaims May 2019 as National Mental Health Awareness Month. And in Montgomery County, we call upon our residents, government agencies, public and private institutions, businesses, and schools to increase their awareness and understanding of mental health and the steps our citizens can take to protect their mental health, accessing our comprehensive behavioral health services for all county residents. It's presented on this 13th day of May in the year 2019, and it's signed by myself and Council President, Councilmember Navarro. Thank you. And if we could introduce representatives from Every Mind and Cornerstone, if you could say a couple words each as well.
Little shorter. Thank you. I appreciate all of you being here. Thank you to Councilmember Albornoz and also Councilmember Jawando and all the council members seated behind me. All of the council members are extremely supportive of our work, Cornerstone Montgomery work, MCPS, as well as behavioral health. And we appreciate that and hope that that continues. And thank you all for being here, and thank you for your continued support, and thank you to the full council.
Great.
Good morning. I'm Cari, Cornerstone Montgomery's president and CEO, and I also want to just say thank you to everyone who's here today, to the entire council, including Councilmember Albornoz and Jawando, and just for the support that we have. This is such an important issue. We've had many things that have come up, whether it's the opioid crisis, teenage suicide. Funding is a necessity, and I know money is not finite, is not infinite. Unfortunately, it is finite. But working together, I think the collaborations that we have, the partnerships that we have with agencies like Every Mind, with the Montgomery County Public School System, and certainly with the County Council, are just key to making sure that we take care of the people in this community. So again, thank you so much.
Thank you both. Let's go ahead and take the picture together, if we can get tighter, and if my colleagues could stand behind us, that would be great.